Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Thank you for coming in today. How can I help you?
Hello, doctor. I've been experiencing shortness of breath and occasional chest tightness, especially when I walk upstairs or do any kind of physical activity. It's been going on for a couple of months now.
I see. Can you tell me about any other symptoms? Have you experienced any coughing, fever, or weight loss recently?
No fever or weight loss, but I do have a cough, mostly dry, that seems to get worse at night.
Understood. What is your age, if you don't mind me asking?
I'm 63 years old.
Do you have any history of smoking or exposure to harmful chemicals?
I used to smoke, but I quit 15 years ago. I haven't been exposed to any chemicals that I'm aware of.
All right, that's helpful to know. Have you tried any treatments or medications for these symptoms?
I've only taken some over-the-counter cough syrup, but it hasn't really helped.
Given your history and symptoms, we need to conduct a thorough assessment. I'd like to start with a chest X-ray and possibly a spirometry test to measure your lung function. We need to rule out conditions like chronic obstructive pulmonary disease, given your smoking history.
I understand. How soon can we do these tests?
I can arrange for the chest X-ray today, and we'll schedule a spirometry test as soon as possible. Depending on the results, we might also need a CT scan of your chest.
That sounds like a lot. Is it all necessary?
Given your symptoms and past smoking history, it's important to be thorough so we can accurately diagnose and treat the problem. It's better to cover all bases early on than to miss something critical.
Okay, I trust your judgment. What happens after the tests?
Once we have the results, we'll review them together. If the tests show any abnormalities, we may need to consider further evaluation or referral to a specialist. If they are clear, but your symptoms persist, we will explore other possible causes.
And what about managing my symptoms in the meantime?
For your cough and chest tightness, I can prescribe an inhaler to help ease the symptoms. It's also important to avoid any strenuous activity until we have more clarity on your condition.
I appreciate that, doctor. I've been quite worried.
I understand it's concerning, but you've done the right thing by seeking help early. We'll do our best to get to the bottom of this. I'll arrange for your tests and see you back here in a week. We'll have more information then and can make informed decisions about your treatment.
Thank you, doctor. I'm glad we're moving forward with this.
You're welcome. It's important to tackle these issues head on. I'll make sure we follow up closely. See you soon for the follow-up appointment.
See you then, doctor.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Miss Thompson. It's great to see you today, though I'm sorry to hear you've been having some difficulties. Your chart notes mention ongoing fatigue and joint pain. Can you tell me more about these symptoms?
Yes, doctor. It's been quite tough. I've been feeling very tired for the last few months, no matter how much I sleep. The fatigue is almost constant, and about the joint pain, it's primarily in my hands and knees. The pain in my knees is especially bad in the morning.
That does sound challenging. Does anything help alleviate the pain or the fatigue?
I've tried taking over-the-counter pain relievers, and sometimes they help a bit with the pain, but not with the fatigue. I've also tried applying heat packs to my knees, which gives me some temporary relief.
Have you noticed anything that makes the symptoms worse? Perhaps certain activities or times of day?
Well, the pain seems to get worse after any prolonged activity, like walking or standing for a long time. And as I mentioned, it's particularly bad in the morning. As for the fatigue, it just seems constant, but I feel even more drained by the end of the day.
I see. Have you had any other symptoms, like skin rashes, fever, or unexpected weight changes?
No fevers, but I've lost a few pounds over the last couple of months without trying. I thought it might be stress-related, since I've been dealing with these health issues.
Understood. It's good you mentioned weight loss. It can be significant. Have you experienced any dryness in your mouth or eyes, or any other changes in your eyesight?
Not really dryness, but my eyes have felt a bit more strained lately. I thought maybe I needed a new prescription for my glasses.
All right, that's helpful to know. Based on what you've described, we should consider several possibilities, including autoimmune disorders like rheumatoid arthritis or perhaps thyroid issues, given your symptoms of pain, fatigue, and weight loss. We'll need to run some tests to check for inflammation markers, thyroid function, and possibly autoantibodies.
That makes sense. I just want to find out what's wrong so I can start feeling better.
Absolutely, and we'll do everything we can to get to the bottom of this. In addition to the blood tests, I'd like to refer you to a rheumatologist. They specialize in joint and autoimmune conditions and can provide more targeted insights.
Thank you, doctor. How soon do you think we can get these tests and appointments going?
I'll have my team schedule the blood tests for you this week, and I'll get in touch with the rheumatologist to see how soon they can see you. We'll coordinate closely to ensure you get the care you need quickly.
I really appreciate that, doctor. It's been a bit scary not knowing what's going on.
I understand, and it's important to address these concerns head-on. Remember, you're not alone in this. We're here to support you through diagnosis and treatment. After we get the test results, we'll have a clearer picture and can discuss the best treatment options tailored to your specific needs.
Thank you so much, doctor. Knowing there's a plan moving forward makes me feel a bit more at ease.
You're welcome, Ms. Thompson. We'll be in close contact, and I'll update you as soon as we have more information. Thank you for being so open and detailed about your symptoms today.
Thank you, doctor. I look forward to hearing from you soon.
Of course. Take care and see you soon. We'll get through this together.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
How are you feeling after the first round of chemotherapy? Any nausea or discomfort?
I actually feel okay right now. I was expecting it to be worse, but I took the anti-nausea medication you recommended.
That's good to hear. It's important to keep those symptoms managed. Do you have any questions about the treatment plan going forward?
Yes, how often will I need to come in for treatments?
Your schedule is set for every 3 weeks. We'll monitor your response and adjust if necessary. It's tailored to make sure it's as effective as possible with minimal side effects.
Thank you for explaining that. It helps to know what to expect.
Now look at question 26.
Sarah, could you check on Mrs. Allen in room 302? She had her gallbladder removed yesterday and might need her pain management reviewed.
Of course. Has she been up and moving, or is she still experiencing a lot of pain?
She's been resting mostly. I think the pain is under control, but she's a bit reluctant to do much.
Understandable. I'll see if she's ready to try some gentle walking with assistance. It's crucial for her recovery.
Great. Keep an eye on her mobility and let me know if she needs additional pain relief.
Will do. I'll update you after I've assessed her.
Now look at question 27.
We're starting a new initiative to enhance the management of diabetes in our patient population. The program includes regular follow-ups and individualized diet plans.
That sounds promising. Are we incorporating technology to help with monitoring their blood sugar levels as well?
Yes, we're recommending mobile apps that sync with their glucose monitors. This allows patients to track their blood sugar in real time and share the data with us remotely.
Excellent approach. How do the patients feel about using the technology?
So far, the feedback has been positive. Many appreciate the convenience and feel more in control of their health. We're seeing improvements in their management already.
Now look at question 28.
There's a case of suspected meningitis in a 20-year-old college student who just came into the emergency room. High fever, stiff neck, and headaches.
Meningitis can escalate quickly. We need to start antibiotics as soon as possible. Have we done a lumbar puncture yet?
Not yet. We were waiting for your go-ahead. Should I prep the team?
Yes, let's proceed with the lumbar puncture to confirm the diagnosis. Make sure the lab prioritizes the sample so we can get results quickly.
Will do. And should I alert the ICU team in case we need to escalate care?
Yes, keep them on standby. Better to be proactive given the potential severity of meningitis.
Now look at question 29.
We have a patient scheduled for a thyroidectomy later today. Any special considerations for the anesthesia?
Yes, the patient has a history of hypertension. It's managed, but we should aim for a smoother induction and maintenance to avoid spikes in blood pressure.
Should we adjust the anesthesia protocol to use agents that have minimal cardiovascular effects?
Exactly, and let's also monitor her blood pressure closely throughout the procedure. Ensure the anesthesia team is aware of her condition.
I'll brief them. Post-op pain management will also need careful handling, correct?
Correct. Let's plan for a multimodal pain management strategy that minimizes opioid use, as they can elevate blood pressure.
Understood. I'll prepare the team accordingly.
Now look at question 30.
We're developing a new wellness program aimed at preventing burnout among healthcare workers. It includes scheduled downtime, access to mental health resources, and regular workshops on stress management.
That sounds timely, especially given the recent staff surveys. How are we measuring the program's effectiveness?
We'll track metrics such as absenteeism, self-reported stress levels, and overall job satisfaction before and after the program's implementation.
What support do we need from management to get this off the ground?
We need to ensure that there's adequate staffing to allow for the scheduled downtime without impacting patient care. Also, management must actively promote the program to encourage participation.
Sounds like a plan. I'll start discussions with the upper management about allocating resources.
Great. I believe this will make a significant difference in our work environment.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Ladies and gentlemen, I'm Dr. Jane Miller, and today we delve into the vital issue of antimicrobial resistance, AMR, a phenomenon that's shaping up to be one of the foremost public health crises of our time. As we advance into an era where common infections could once again become deadly, understanding and addressing AMR is crucial. AMR occurs when microorganisms such as bacteria, fungi, viruses, and parasites change in ways that render the medications used to cure the infections they cause ineffective. Every time a person takes antibiotics, sensitive bacteria are killed, but resistant germs may be left to grow and multiply. This is a natural phenomenon, but it's significantly accelerated by the misuse and overuse of antimicrobials in humans, animals, and agriculture. The implications of AMR are dire. Without effective antimicrobials for prevention and treatment of infections, medical procedures such as organ transplants, cancer chemotherapy, diabetes management, and major surgery become very high risk. AMR increases the cost of health care with lengthier stays in hospitals and more intensive care required. One of the significant drivers of AMR is the inappropriate prescribing and overuse of antibiotics. It's estimated that up to 50% of all the antibiotics prescribed for people are not needed or are not optimally effective as prescribed. This misuse of antibiotics encourages the growth of antibiotic-resistant bacteria, with recent reports suggesting that antibiotic-resistant infections are responsible for 700,000 deaths each year, a number that could increase dramatically if current trends continue. Another challenge in combating AMR is the lack of new drugs in development. The antibiotic pipeline is drying up, largely due to economic and scientific challenges. Antibiotics are not as profitable as drugs for chronic diseases because they work quickly and are taken for a short period. Moreover, the scientific challenges associated with discovering new effective antibiotics are significant. To tackle this issue, we must promote the appropriate use of antibiotics, enhance infection prevention and control, and foster innovation and research in new antibiotics. For instance, health professionals need to prescribe antibiotics only when they are needed, and when prescribed, the full course must be completed to fully eradicate the infection. However, individual responsibility alone won't suffice. We also need coordinated action. Governments must strengthen regulations and implement policies that reduce unnecessary antimicrobial use. Additionally, there should be a global push for investment in new drugs, vaccines, and diagnostic tools. Let's consider a scenario. A young boy named Michael develops a common bacterial infection and is prescribed antibiotics. However, due to previous misuse of antibiotics, the bacteria are resistant and the standard treatment is ineffective. His condition worsens, illustrating a frightening but growing trend of how ordinary infections can turn life-threatening. Michael's story is not unique, and it underscores the need for urgent action. We must increase public and professional awareness of AMR and encourage best practices at the points of antibiotic creation, distribution, and use. In conclusion, AMR is not a distant threat. It is a present reality that requires immediate and robust action from all stakeholders involved. The complexity of the problem necessitates a multifaceted response that spans healthcare, policy, and research. By uniting in our efforts, we can mitigate this global health threat and secure effective antimicrobial treatments for future generations. Thank you for your attention today, and I am eager to discuss your thoughts and questions on this critical topic.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, everyone, and welcome to this session of the Global Health Conference. I'm Dr. Susan Hartley, an endocrinologist specializing in diabetes management at the Advanced Medical Research Center in New York. Today, I am excited to delve into the fascinating world of continuous glucose monitoring, CGM systems, and their transformative impact on the management of diabetes. This technology represents a significant leap forward in our approach to personalized medicine for diabetic patients. Diabetes, as you know, is a prevalent chronic disease affecting millions worldwide, characterized by high blood sugar levels over a prolonged period. Traditional management methods rely heavily on periodic blood glucose testing, which can miss fluctuations and trends. However, the advent of CGM systems has begun to change the landscape dramatically. CGM devices continuously track glucose levels throughout the day and night, allowing patients to see their glucose levels in real time and observe how they fluctuate in response to factors like diet, exercise, and medication. This technology provides a more comprehensive picture of glucose control than traditional fingerstick measurements, which only provide a snapshot in time. In our recent research project, we embarked on a 6-month study involving 200 patients with type 1 diabetes. These participants were randomly assigned to one of two groups, one using traditional blood glucose monitoring and the other equipped with the latest CGM devices. Our goal was to assess not only the impact on glucose control, but also on the quality of life, anxiety related to diabetes management, and overall treatment satisfaction. The results from our study were compelling. Patients using CGM devices showed a significant improvement in their hemoglobin A1C levels, a marker for long-term glucose control, compared to those who continued with traditional methods. More impressively, the CGM group reported a 40% reduction in the incidence of hypoglycemic events, those frightening periods when blood sugar levels drop dangerously low. Moreover, CGM users expressed greater satisfaction with their diabetes management, stating that the real-time data and the trends displayed by the devices empowered them to make immediate adjustments to their lifestyle and treatment options. This empowerment is crucial, as diabetes management is not just about controlling blood sugar, but also about enhancing the quality of life. Another intriguing finding from our study was the psychological benefit associated with CGM use. Participants reported lower levels of anxiety and fear regarding potential glucose extremes, commonly referred to as fear of going low. This psychological relief is significant as it can lead to more confident decision-making and improved overall mental health. Despite these promising findings, it's important to acknowledge certain limitations. The cost of CGM systems can be prohibitive for many patients, and there are still challenges related to insurance coverage for such devices. Additionally, some patients may experience issues with sensor accuracy, which can affect their trust in the system. In conclusion, our research strongly supports the role of continuous glucose monitoring as a transformative tool in diabetes management. As we move forward, it is crucial to address the barriers to access and improve the technology's integration into standard diabetic care practices. With these efforts, we can hope to provide a more dynamic, responsive, and patient-friendly approach to diabetes management. Thank you for your time, and I am eager to hear your questions and discuss further the implications of our findings.